everyone. I am Dr. Anil Mandhani, Executive Director in the Department of Urology and Kidney Transplant in Fortis FMRI. Let's talk about bladder cancer, which can happen in men and women both. So one of the known reasons that can cause you bladder cancer is smoking. If you're a smoker and smoking for longer duration, so that increases the risk of having bladder cancer. And there are other factors, like if you're working in paint industry or the rubber industry or some chemical exposure you have, that increases the risk of bladder cancer. So the most important thing is, if you're having blood in urine, you should never ignore it, because blood in urine is always an alarming sign, and you should visit a urologist to see whether you have bladder cancer or not. The smaller tumor can be managed by removing them endoscopically. We call that TURBT, transurethral resection of the bladder tumor. So we remove the tumor, send it for biopsy, and depending on the biopsy result, we decide whether to preserve the bladder or to remove the bladder, depending on the muscle invasion. So preservation is possible if it is not that deep, if the cancer is not that deep. If we can still preserve your bladder by giving you a BCG installation or other therapeutic agents which are given inside the bladder. But if it is involving the muscle of the bladder, then bladder has to come out, and we create new bladder with the help of intestine. If you're young and healthy and you have bladder cancer, then we can remove the bladder and make a new bladder with the help of intestine and fix it so that you can pass urine with the natural way. But if it is not so, like if you're very elderly, you have some other issues like kidneys are not normal, then we create a channel and put a pouch where urine is collected, and this pouch is stuck on your belly, on the abdomen. So these are the two important ways we treat, and this facility of creating new bladder is available at FMRI. And the only thing I would repeat is, you should never ignore the symptom of blood in urine. Thank you.